Hello, everybody. Welcome to the Why I Help podcast, the podcast that is focused on the majority of people who are doing good things and helping others. Unlike the mass media, we don't focus on just the bad guys. We want to know about the good guys because, truthfully, there's way more good people out there than there are bad people. So today we have an interview with a lady named April Lott. April is the president and CEO at Directions for Living, a not-for-profit child welfare and behavioral health organization providing a comprehensive network of services promoting safe and stable families. Directions for Living is based in Clearwater, Florida, and has a staff of approximately 250 employees and over 100 volunteers. I want her to tell us more about Directions for Living, so let's talk to April Lott. April Lott, thank you so much for being willing to be on the podcast today and helping us spread the good news. I know you're doing good things, and I can't wait to hear about it.
Good. Yes. Thank you for having me.
Absolutely. So if you would, tell us a little bit about yourself, like where you grew up, what your upbringing was like, because you work in a nonprofit and not everybody wants to go that direction. So tell us kind of how you arrived there.
Yeah. So I was born and raised in Pinellas County, which is, where I'm located today. I was raised by my mother, who was in law enforcement and was pretty adamant about service to others. And when I was about 14 years old, we went to a garage sale that was being held at a local church that was near our home. And my mother bought me a book for 10 cents that was titled Sometimes God Has a Kid's Face. And I read that book and felt committed and drawn and convicted to service, in particular service to children who were being abused and were neglected and were kind of our forgotten children. And I really just felt like that book was written specifically for me. And that really is how I got started. I mean, certainly it's in my roots of my mother's, entire career to service. She was the first victim advocate in the state of Florida. She went on to do some pretty amazing things. And so that certainly contributed, no doubt, to where I am. But I firmly believe that the book that I bought for 10 cents, or that my mother bought for me for 10 cents at this yard sale, is really why I am who I am today.
That's a great story. I love that. I mean, that's the inspiration right there. What a great story. Sometimes God has a kid's face.
Yep. Sometimes God Has a Kid's Face is the title of the book. I still have it to this day. It still sits on my bookshelf here in my office. And yeah. And there
Wow.
were a series of books that came after that that were equally inspirational to me, but really that first one was the one that called me to a career of service.
I love that. So how did you start? What did you start in terms of service? How did you get going?
Well, at the time, St. Pete College was St. Pete Junior College, and so I started at St. Pete College following my my high school graduation. And I really thought at the time that I wanted to be a teacher, and that serving children through education was really the path for me. And interestingly enough, my guidance counselor at St. Pete Junior College at the time, I have a very distinct memory of walking across the field with her and her saying, that she had this opportunity for me to get a double major, and that, I would need to do a practicum or an internship. And at the time it was with HRS, and which I signed up to do. I said, okay. And so I signed up to do the internship in the Department of Protective Investigations, investigating abuse and neglect of children. And after my first week, I thought, this is not for me. this is entirely too difficult and entirely too awful. And so I went to meet with my advisor, and, we walked across the field, and she said something along the lines of, if not you, then who? And it hit me, right? That this is not work that is attractive to anybody, but some of us are chosen to do this work because it's important and necessary for the overall health and safety and well-being of our community. And so when she said, if not you, then who? I thought, she's right. And I have to say, I've never looked back. So I started as a protective investigator, investigating abuse and neglect under HRS. And then I went on to do quite a bit in investigating sexual abuse of children. I worked with sex offenders for a period of time, ultimately got my master's degree and became licensed as a clinician. And then really just kind of found myself always working my way back to administrative type positions. And then about 15 years ago, came to Directions for Living as the CEO.
Wow. I really want to say, good for you. I I don't know if I could go into a field like that. I am all about helping people. That's why we do this podcast and why we do our other podcast. But you could have walked away, and I would have understood that. I actually thought that was the direction that your story was going to go in, and I would have been okay with that because that's not an easy thing to confront by any stretch of the imagination. And the fact that you stuck with it, I mean, well done you.
Yeah, thank you. And it's interesting because now I say to people who are, first beginning or first entering the field, I quite frankly say I think everybody should, who wants to be in social services, should work in protective investigations, at least for a period of time. I think that in addition to painful things that I no doubt saw and encountered, and I have stories for days that are awful stories. But in addition, you also get to see the best in humanity in that position, which I think is an often overlooked aspect of it. But I actually witnessed and observed and learned from some of the best examples of humanity relative to families and caring for children and protective capacities and all of those things as well. So
you make a very good point. I sorry to interrupt you. You make a very, very good point, which I make at the beginning of this podcast. And that is that the majority of people are good and they're trying to help other people. You unfortunately had to focus a little bit on the ones who are not trying to help and are bad, doing bad things to people. But the majority are not like that. And the fact that you can keep that perspective while being involved in, what do you call it, protective investigation?
yeah,
Yeah.
yes,
While you're involved in that, I think that's huge. And I think that I'm evaluating for you. I apologize, but I think that possibly might be why you would stick with the work that you do, because you know
absolutely,
that the majority
absolutely.
of people are not bad and they really just need help. So, well, very well done you. So did you, when you moved more into administrative, did you go directly into Directions for Living, or did you work with other organizations?
Yeah, so my career actually started in 1983 is when I started as a protective investigator. So it's been, I don't even know the math at this point. It's been 35, 36, 37 years. I've been with Directions for Living for the past 15.
Okay.
But prior to that, I kind of weaved my way in and out of direct frontline kind of service provision and administration. And then I would go back into frontline service and then back into administration. And I have to say that journey for me was important because I am a clinician at heart, and I get a lot of inspiration from client care and from the actual work of service to individuals and families. And so, being exclusively in an administrative position would not have inspired me or kept me, committed or motivated for as long as I've been really in the field.
I I completely agree. It's like the CEO of a company making shoes who is willing to get down on the floor, the warehouse floor, and help make the shoes. You cannot, I don't think you can be a good leader without that viewpoint and without,
Yeah,
stepping down to remind yourself who you're working with, who's important. And that's huge. That's
yeah.
huge. How did you get attracted to this organization? Were you in on the ground floor or was it already operating?
No, it was already operating. So, Directions for Living began in 1984, and as I said, I was born and raised here. So I was, a very young professional when Directions for Living kind of began, and it was a very small organization, and I was only, familiar with, at the time it was called Directions for Mental Health, and um, and so I didn't in the beginning see myself at Directions for Mental Health. I was in Child Protective Investigations. I worked locally in Child Protective Investigations. And after I left that, I went into working with actually with probation and parole. I was a probation and parole officer for offenders, sex crimes against kids. And I did that because as a child protective investigator, I was losing perspective on the people who were actually perpetrating the crimes, and knew there was more to the story, if you will. And not that I was ever leaning towards kind of the abuse excuse, but more that I just knew that there was more to the story. And if we were ever to get ahead of it and or prevent it altogether, we needed to know more about the offender themselves. And so I just kind of saw my career as stepping stones, kind of building blocks, if you will, to ultimately get me where I am today. But I had left Pinellas County. I was in Orlando for many years, also in social services, and then just had the opportunity to come back home because of my parents and some other things that were going on. And so when we, moved back to Pinellas County, I really had options in terms of where I was going to go work. And almost for the first time in my life, I had options. I didn't have to work, and I didn't have to accept and or accept a position that was not going to be fulfilling for me, and ultimately chose Directions for Living because of its reputation, its at that point its long-standing history. There had really only been two CEOs of the organization. It was a very stable organization doing really good things, and I just thought that it would fit for me in terms of where I was in my career.
I think that's huge. And I'm very thankful that you did go into that position. And I also just want to say that while I completely understand you don't want to take the viewpoint like, oh, it's okay, he's abusing a child because he was abused. I get that. But the more understanding that we can get on why people do what they do, it doesn't excuse it, but
Exactly.
it's understanding, and we have to have understanding in areas like that. So, okay, so Directions for Living. Lead the listeners through what the focus is of Directions for Living and what are the services that you guys offer.
Okay, so Directions for Living, it started as Directions for Mental Health, and it really was missioned then back in the early 80s, mid 80s. It was really missioned around this idea that there were people in our community who had or were experiencing a mental health condition, living with a mental illness, experiencing mental health crises, who were uninsured and did not have what people referred to back then as the indigent. I think that's a very pejorative name. It's not one that I think we should be using in today's day, but back then, so Directions for Mental Health at the time was really mission to provide access to quality mental health services to people who otherwise may not be able to afford or have access to mental health services. And so we were born really to be community mental health, to be a community mental health center for those people who otherwise couldn't access or afford access to those services.
Interesting. And I think that in the past, pretty much if someone was exhibiting some sort of mental difficulty, they were just sent to a mental institution, a mental hospital, which, truthfully, in my opinion, should only be used for the criminally insane, not the mother who is suffering from postpartum depression, or the child who is having tantrums. And so I think that the services that you guys offer it's huge. It's what's needed for a lot of different people. One of the questions that Summer, your friend Summer, thought we should ask, which I think is a really good question, especially for now. I know we're coming out of COVID, but there's still some people that are struggling. And it was, what are some of the ways that we can start practicing self-care in terms of mental health?
The standard answer to that is something around, exercise, good nutrition, good sleep hygiene. All of those things are absolutely still true and grounded in science, right? We should be getting exercise, we should be eating generally well, and we should be practicing very good sleep hygiene, getting adequate amounts of sleep. But my bigger answer, I think, to that really is around, and it was always true. It is particularly true now that we've all kind of gone through a pandemic together, and that is around relationships. What we know is problematic from a mental health and a mental well-being standpoint is loneliness is what is at the crux of hurting so many people. It really tends to be the common denominator in people who end their life by suicide. It is loneliness, and loneliness is an interesting concept, right? We are relational beings.
Yep.
We just are, and
Yep.
what is true is that there are, thousands of people who have good jobs, are not impoverished in any way, shape, or form, but are still nonetheless very lonely. They don't have a good support system. They don't have people that they can be, fully transparent and honest with, and they live this life surrounded by people, but still incredibly lonely. And then, of course, there are the added dynamics for people who, in fact, don't have good jobs, who don't have stable housing, who don't have enough to eat. They have all of those same challenges and they're lonely. But the loneliness factor is one that I think we need to begin paying more attention to, about quality relationships and understanding the benefit of relationships to others.
I think that's huge. I think that's incredible advice. I went a little bit out of sequence. So let's go back to your organization and just lay out for us just some of the services that you provide, so that if someone listening and they are local in the Tampa St. Pete area, if they wanted to reach out to you, what would be some of the reasons why they would do that?
Yeah, so kind of picking up where I left off, we kind of transitioned over the last 35, 37 years following the science. So while we started as a community mental health for people who otherwise couldn't afford it, we've evolved. We still provide mental health services. So I have a team of psychiatrists, I have a team of therapists and clinicians. We also have a team of case managers. One of the first evidence-based research supported practices in the country around working with people with complex mental health conditions is really having somebody to help advocate and navigate systems, which is commonly referred to as case management. So we have a whole division or department of case managers as well. And then over the years, we have appreciated the nexus between people who live homeless and or chronically homeless, who also have a co-occurring mental health or substance use disorder. And as we began to kind of branch out into these nexus, where there is a nexus, where there is an overlap between these other, what I'm going to call social health, public health type issues like homelessness, like child welfare and the abuse and neglect of children, like the Department of Juvenile Justice and criminal justice. So we are also now in all of those spaces. So we provide services to children and families who are at risk of abuse and neglect, where there is domestic violence, undiagnosed, untreated mental illness, substance misuse. We also work in partnership with our law enforcement community as they are being called to respond to people experiencing a mental health crisis more and more frequently. And we do quite a bit in the homeless prevention and homeless services arena. So we do a lot to rehouse people, to make sure that they're connected to services, mental health services and other services. We help people get entitlement benefits like Social Security and Social Security disability insurance. So really, I think if somebody was really interested in Directions for Living, I would encourage them to go to our website. We really do have a whole host of services that intersect with good quality mental health, is really our focus.
Awesome. I think that's huge. Is there maybe a story of someone who came to your organization that sticks out in your mind that you could just share with us?
That's interesting. We have so many of those stories where our clients will kind of write in and say, you absolutely saved my life. Some of the stories that we started about, I'm going to guess, maybe 6, 7, 8 years ago. My marketing team, Summer and her team, started a no shame campaign. And so, because what we knew then, and certainly what we still know today, is that stigma is often the barrier to people connecting and getting the services that they need as early as they need them. Often we're waiting until people are in a crisis, as opposed to, getting services early. And it really is because of stigma. So we started a no shame campaign, and I have to say some of my stories would really come out of the no shame campaign, where the individuals who we have treated for a severe or persistent mental illness for years, volunteered, were nominated by their staff, by their service providers, volunteered, came in, worked with our marketing team, not even clinicians, worked with our marketing team to kind of learn how to tell their story, and then went through a makeover. In other words, they literally got a physical makeover, and then had the opportunity to, with a professional videographer, to tell their story.
Wow.
Many of these stories are still contained on our website. So if anybody's interested in listening to one of these stories, they're available to you. But essentially, one woman in particular who is diagnosed with a severe and persistent mental illness struggled a lot, even with communication, self-esteem, really didn't have any friends, was an adult, doing her best to just kind of live her life, but it was a struggle. She got nominated for the No Shame campaign. She went through that process, and to tell you that she became a different individual who, of course, was always within her. It would be an understatement. She literally blossomed to be somebody who routinely went around with the no shamers to high schools and to other groups and presented their stories.
Wow.
And stood before audiences of 1,000 and said, I am diagnosed with schizophrenia and I have no shame, and told her story. And
wow.
It to see it's still to this day, as I tell you, I get goosebumps and
So do I.
emotional as I watched people in that audience kind of stand to their feet and surround her like she was a rock star to say #me too. I too have lived with these things, and you've inspired me to tell my story. And and so the No Shame campaign, and I have to tell you, we have a group of 5 or 6 every year who are selected to go through the process. And for that entire year, they kind of become the speakers bureau that we send out to the community to speak on behalf of and talk about mental health. And every single time I am astounded, and it almost takes my breath away around my marketing team therapeutically. What is astounding, you probably don't find it astounding because I think you're doing the same thing through this podcast. And Steve said in the beginning, right, that you started as marketing people. But what is interesting is what having an advocate and a marketing team can do to help people. And the No Shame campaign has literally been single-handedly one of the most phenomenal things that we continue to do as an organization.
Wow. That's awesome. And yeah, we do have a little bit of a parallel because on our original podcast, which is all about addiction, when we have someone on our podcast who's in recovery and we just let them tell their story, it's huge. We watch the person, really come to life and get even more inspired to help others than before they were interviewed, because telling your story and reaching out to help others is absolutely huge. The website is directionsforliving.org for anybody that's listening. April, if you just had one message to leave people with, what would that be?
I think it would be that we all have mental health. We all have, if you have a brain, right, then you have an obligation to tend to your mental health. And it is not an us and them dynamic. It is all of us. And, my message would be that, we all need to care, not just for ourselves, but for others. And in order to create the compassionate society I think that we all want to live in, that it really is about caring for one's mental health and caring for others, so that that we're all the best selves that we're all our best selves. I think, and if someone goes to our website, they would be able to see this. I didn't get to speak about, but one of the things that I also think is so important is just the relationship between trauma and exposure to trauma in early childhood and kind of health outcomes in general in adulthood. And that, again, for people who are adults who are struggling with any number of things, including COPD or asthma or a physical health condition, many of those people, if not all of those people, had an exposure to childhood trauma, to an early childhood trauma. And the more we become sympathetic and empathetic to our peers who are doing the very best they can, I think the more likely we are to create the society and the environment that we all deserve to live in.
Thank you. Thank you, April. Thank you for talking to us today.
Thank
Amazing
you.
story. Amazing the work you're doing. Thank you.
Thank you. Thank you for having me.
Great interview. Great advice. When I asked April about, some advice for how we can take care of our mental health, I kind of sort of knew what direction she was going in, but it's so very true. Yes, we need to eat healthy. We need to get sleep. We need to do exercise, but we need to have relationships. There's that famous saying, and I apologize, I don't remember who said it, no man is an island, and that is the truth. So if you are suffering in any way, please reach out. There are a lot of good people out there who are willing to talk to you and willing to help you and refer you to organizations like Directions for Living if that's what you need. So we'll be back again next week. There's a lot more good people out there doing a lot more good things, and we're going to talk to them and tell you about them.